So let's talk about the female external and internal genital organs. Okay, so this is the view of the female pelvis. Okay, so here we see the ovary, the fallopian tube. This is the uterus, but we can appreciate that this is the body, right? Then we see the uterus piercing the vagina with the cervix. Okay, then the vagina then continues into the external environment. Then here, right, we see structures which form part of the external genitalia. These were the internal genitalia. This is the what? The external genitalia. Okay, collectively they're called the vulva. Okay, so we'll talk about them. So these were contained in the pelvic cavity. These are contained in the perineum, right? So start off with we have the ovary, which is the site of production of oocytes. Okay, so the ovary is enclosed by a thin fibrous capsule called the tunica albuginea. Okay, then inside the fibrous capsule we have a layer of germinal epithelium which forms the lining of the ovary, and the ovary is divided into a cortex and a medulla. In the cortex, that's where we find the developing oocytes, which will be enclosed by germinal epithelium, okay, which will be now called follicles, right? Then in the middle of the ovary we have the medulla, okay, which acts as the connection sites for neurovascular structures. So the neurovascular structures, the arterial supply, lymph drainage, and the plexuses of nerves, they will enter via the medulla. Okay, so we should take note that the ovary, right, is supported in the pelvic cavity by what's called the broad ligament. Okay, so the broad ligament has what is called the suspensory ligament, okay, which supports the ovary to the lateral pelvic walls. Then the broad ligament has what's called the mesovarium, okay, which connects to the what? To the suspensory ligament, right? It's also a part of the what? The broad ligament. The broad ligament is a double layered fold of peritoneum, okay, which encloses the structures here, which we'll talk about soon enough. Okay, then also we should appreciate that the ovary is supported by the what? The round ligament. Okay, so we have what is called the gubernaculum, which was acting as which was providing the pathway for the ovary in females and the testes in males for them to descend into their original positions. Okay, so the gubernaculum, right, the upper part, the remnant of the upper part is the what? The round ligament of the ovary. Then the lower part, okay, is the round ligament of the what? The uterus. The round ligament of the ovary, it will attach to the what? Uterus, providing support to attach to the lateral margins of the uterus, providing support to the what? To the ovary. And the ovaries, we have one on the left and on the right normally. Okay, normally there are two, left and right. Okay, then the nerve supply will be from the aortic plexus. Then the blood supply, it will come from the ovarian arteries. Okay, but we should take note that the ovary, it lies in the ovarian fossa. So it lying in the ovarian fossa, there okay, before that, we should take note that there is like anastomosis between the artery from the internal iliac artery called the uterine artery with the branches from the ovarian artery. So technically we can say that the ovary has dual blood supply from the ovarian artery, right, and also from the uterine artery. The uterine artery give branches, okay. Then also the ovary has like very close relations with the external iliac artery, so it will get some branches from there, okay. We call them ovarian branches from the external iliac artery. Then the venous drainage is from the ovarian vein, okay. So on the left, they'll go to the ovarian veins, will drain into the left renal vein, and on the right, the ovarian vein will drain into the inferior vena cava. Uterine tubes, okay. So the uterine tubes, they connect to the ovary, but there's like a space between the ovary and the uterine tubes, okay. So the uterine tubes are divided into infundibulum, ampulla, isthmus, and intramural part. The infundibulum has finger-like projections called fimbriae, which soup up the secondary oocyte and provide like a conduit pathway for it, okay. Then we have the ampulla, which is the site of fertilization of the secondary oocyte and the sperm to form the egg or the ovum, okay. Then it's the widest part, okay. And we have the isthmus, which is the narrowest part of the tube and lies lateral to the uterus, okay. It lies lateral to the uterus. Then lastly, we have the intramural part, which is the segment that pierces the uterine wall. It is in communication with the uterus, okay. The blood supply of the uterine tubes, to get its blood supply from two areas, from the ovarian artery, okay, it will give uterine branches. Then from the uterine artery, it will give also the branches which will supply the fallopian tubes. Then veins will follow the arteries, to follow the uterine artery to the to the like the veins will correspond with the arteries. Like we have uterine vein and ovarian vein. Then nerve supply is from the sympathetic and parasympathetic nerve plexuses, specifically the inferior hypogastric plexus. Unlike the ovary, the uterine tubes have nerve supply from the inferior hypogastric plexus. It's only the ovary which has its own nerve supply here. You will notice that. Then the uterus, we divide it into three parts: the fundus, the body, and the cervix. The fundus, okay, lies above the entrance of the uterine tube. The body lies beneath the entrance of the uterine tube, and it narrows where it becomes continuous with the cervix. The cervix will pierce the vagina, okay. So yeah, and also in the body of the uterus, that's where we find implantation of the fertilized ovum or egg, okay. So the cervix here, we should say that is the narrowest part of the uterus, communicates with the uterus at the internal os and with the vagina at the external os, okay. So as we can see, as the uterus pierces the vagina, it will form these fornices, okay. We have lateral fornices. In the position of the uterus, the normal position of the uterus is anteverted and anteflexed, okay. So anteverted is image C, anteflexed is image D. Anteverted is where the uterus is, the forward bending of the uterus. It's the forward bending of the uterus along the long axis of what? The vagina. Then anti-flexed is the forward bending of the body of the uterus on the cervix. Okay. So this is the normal position of the uterus. It will be behind the bladder, okay, and in front of the what? The rectum, okay, being at right angles with the uterus, being at right angles with the vagina, and the body of the uterus being at about 170 degrees with the what? The cervix. Okay. Here, these are anomalies, okay, where we might have retroversion and retroflexion, where the uterus is facing the opposite direction, okay, and the angles are not like in their correct position, okay. Then blood supply, dual blood supply, because of the anastomosis, so it's from the uterine artery and the ovarian artery. Then the veins will correspond with the arteries, okay. The nerve supply from the inferior hypogastric plexus. Then the support, so we see that the uterus is supported by the pelvic diaphragm, supported by these ligaments, okay. These ligaments are condensed pelvic fascia, okay. We have the sacrocervical ligament, okay, which is attaching the cervix to the lower end of the sacrum, okay. Then we have the pubocervical ligament, okay, which is attaching the cervix to the pubic bone, as you can see here. Then we have the transverse cervical ligament, which is attaching the cervix to the lateral margins of the pelvis or the pelvic wall. Okay. Right. Then lastly, we have the perineal body. It's not clear here, but the perineal body here, it's also supporting the what? The uterus, preventing it from prolapsing. That was the major support. 1, 2, 3, 4, 5. Then minor support, we have the broad ligament, right? This one, okay. Double layered fold of peritoneum, which houses these structures which you can see here, which houses the ureters, houses the round ligament, okay, and it houses the fallopian tube and the likes, okay. So it also houses those vessels, okay, which we are seeing on that image, right? So we should appreciate the fact that it provides support to the uterus, but it's minor support. Then we have the round ligament of the uterus now, which comes from the uterus, okay. It's a remnant of the gymnoculum and goes through the what? The inguinal canal, okay, to attach to the labia majora, okay. Labia majora. But the ovary is in the pelvic cavity. It does not descend to the labia majora. It just stays in the labia. It stays in the pelvic cavity. And this round ligament of the uterus will help the uterus to be antevated and anti-flexed. Okay. Then we should appreciate that the visceral pelvic fascia around the cervix here is called the parametrium. Okay. Parametrium. Then we have this clinical. We say that implantation, normal implantation happens at this area, the what? The body of the uterus. Okay. Specifically, it's called the endometrium. Okay. It has the necessary glands, necessary blood vessels, okay, which are conducive for implantation. However, the thin-walled uterine tube cannot fully accommodate this process. Therefore, if implantation happens in the uterine tube, it will rupture, and there will be a lot of blood in the pelvic cavity. Now the vagina access the birth canal, access the excretory duct for menstrual flow. Okay, so we see that the vagina it also has it's like it's pierced by the cervix to form like these fornices, okay, where it has the anterior fornix, posterior fornix. If we are looking at the medial view, this is like medial view. Then if we are looking anteriorly, then it will have a right fornix and the left fornix. Okay, and we appreciate the fact that the bladder lies between the vagina. Okay, it will lie between the upper part. It will lie between the bladder and the rectum, and the lower part it will lie between the urethra and the anal canal. Okay. Those will be the relations. So if the support which we're talking about gets kind of ruptured during childbirth, we see that we can have a prolapsed uterus where the uterus descends into the vagina. Okay. Also during childbirth, if the support to the vagina, which is kind of similar to the support to the uterus, gets damaged, we might have prolapse of the vagina, where the vagina will sink out. Okay, and this sinking out will just we will notice that the uterus will be in normal position. Okay, then we should also appreciate this, okay, that in the anterior abdominal wall we have peritoneum, which descends into the pelvic cavity to cover the superior surface of the bladder, then the uterus, okay, then some part of the vagina, right, posterior upper part of the vagina, then some part of the the rectum. Okay, so we see that there are these potential spaces here, right? These potential spaces, we have the space between the bladder and the uterus called the uterovesical pouch. Then we have the space between the uterus and the rectum called the rectouterine pouch. Okay, there are potential spaces of herniations here. Okay, so this space is also called the pouch of Douglas. Okay, so this is the perineal body, right, which is also supporting the uterus. Okay, right, let us move. Then we have vaginal examination. So if we were to insert if we were to do a vaginal examination, what would we see? Okay, so we appreciate the fact that in the upper third, somewhere here, we'll feel anteriorly, we'll feel the posterior surface of the bladder, then the ampulla, okay, of the rectum. Then in the middle third here, we'll or in the middle and lower third, anteriorly we'll feel the urethra of the bladder, then posteriorly we'll feel the perineal body here. We'll feel the perineal body. So right, then also I didn't mention this, but superiorly we also feel this pouch. If we were to do the vaginal examination, we feel this pouch, okay, the rectouterine pouch. So we can feel it here, and we can feel the contents which are sometimes found in the rectouterine pouch, the contents which are movable, covered by peritoneum. okay, such as the sigmoid colon and the ilium coils. Okay, we can feel them here, right? So we should appreciate the fact that at the external os of the cervix, right, we have in females that have never given birth, it is circular like this, the external os. But in females who have given birth, we have like these lips, where we have an anterior lip and a posterior lip here. Anterior lip, posterior lip. So this woman is called nulliparous, okay, and this woman is called multiparous, okay. A female that is not given birth, nulliparous, now for 0, okay. Then a female who has given birth, multiparous, okay. Then the support of the vagina, okay. Upper third, so this is the vagina, right? See, it's written vagina, so it's in communication with what? The cervix. The upper third, we have support from this muscle, the levator ana, group of what? Muscles, okay. They were also supporting the what? The uterus. Then we have the these ligaments, such as the transverse cervical ligament, also supporting the what? The vagina, so that it does not prolapse, okay. Then we have the sacrocervical ligament here, then the pubocervical ligament here. You can also see it here, 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 here. Then we have the perineal body here, right? That's the upper third. Then the middle third, we have the urogenital diaphragm, this one, supporting the vagina. Then the lower third, we have the perineal body. I think I showed you this one, the perineal body supporting the lower third of the vagina, okay. Then we might have what is called pelvic inflammatory disease, where, since we said the vagina is in communication with the external environment, it may transmit bacteria which may cause inflammation to spread to the uterine tubes, to the uterus, and ultimately in the pelvic cavity, okay. Then the external genitalia, they are collectively called the vulva, okay. So we have what's called the mos pubis, okay, which is a hair-bearing skin found in front of the pubis, okay, somewhere here. Then we have what is called the labia majora, okay, which are prominent folds of skin which contain fat and hairs on their outer surface, okay. They are like similar to the scrotum in males, or homologous to the scrotum. They enclose what is called the labia minora. And remember, we said that the labia majora is connected to the what? To the round ligament of the what? The uterus. The round ligament of uterus will attach to the labia majora, okay. Labia minora is enclosed in the by the labia minora, okay. Labia minus, it's also called labia minus, right? So these are also two smaller folds of skin, but these ones are devoid of what? Of hair, and they lie between the labia majora. They fuse posteriorly to form the falchette, and anteriorly they split, okay, to form this like foreskin called prepuce anteriorly, okay. And this foreskin will cover what's called the glans clitoris, which is homologous to the what? The penis. We'll talk about it in the next slide. Then posteriorly they'll form the frenulum, this one, okay. Then lastly we have the vestibule, okay. The vestibule of the is the space between the labia minora. So the labia minora, anything that's enclosed by it, okay, by the labia minora, is the vestibule. So the vestibule, superiorly we have the glans clitoris. Then in the mid you have the urethral opening. Then below we have the vaginal opening, and in virgins to be covered by hymen. Okay, covered by hymen, which is a thin fold of mucosal membrane. It may be present, it may be absent. Okay, in vaginal women. Okay, then we have draining in the vaginal opening from the greater vestibular glands. They will secrete mucus and their fluids in there. Okay, which will act to maybe in the sexual act, coitus or sexual intercourse, so that it's not painful, right? So now let's talk about the clitoris. The clitoris is homologous to the penis. Okay, similar to the penis. The glands of the clitoris is partially hidden by prepuce or foreskin. Okay, then the root of the clitoris, it's composed of 3 bands of erectile tissue. We have the bulb here, the bulb of the vestibule, right? They look like 2, but it's actually 1. It's because of this vagina that they seem to be 2, but they are just 2 halves that make 1 bulb. Okay, then we have 2 crusses. Okay, we have the right crus and the left crus. So the bulb is covered by the bulbospongiosus muscle. Okay, under the urogenital diaphragm, so, or the perineal membrane, which you can see here. Then the crus are covered by the ischiocavernosus. Okay, just similar to what we're talking about in males, right? So the bulb of the vestibule will unite to form the clitoris. Okay, right. Form the glans clitoris. Okay, so yeah. Then the greater vestibular glands, we talked about them. They drain into what? The vagina. Okay. Right. Right. Then the last thing which we did not talk about is lymphatic drainage of the ovary, uterus, fallopian tubes, and vagina. Let's start with the ovary. The ovary drains into 3 areas. It will follow the ovarian vessels to the para-aortic lymph nodes. It will follow the uterine vessels to the internal iliac lymph nodes. Then it will follow the round ligament to the superficial inguinal nodes. Okay, then the uterus. The uterus, we have the fundus and the body and the cervix. So the fundus will drain into the para-aortic lymph nodes. Okay, then the body and the cervix will drain into the internal and external iliac lymph nodes. Okay, then lastly we have the fallopian tubes. Before the fallopian tubes we have the fallopian tubes and the vagina. So the fallopian tubes, they will drain into the para-aortic lymph nodes and also the internal iliac lymph nodes. Then lastly the vagina will drain into the superficial inguinal lymph nodes. Then lastly we have the female urethra, which is shorter in females than in males. It's about 3.8 centimeters long, and it extends from the bladder to the external meatus. Okay, passes through the urogenital diaphragm, and it opens onto the surface below the clitoris and in front of the vagina. Okay, so that was the female external and internal genitalia. Thank you.